Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvira Deshpande, MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. Yes, double post-graduation. Would like to welcome you all in Ayurveda Academy YouTube channel. Channel is for everybody. Channel is for medical students, doctors, professors, patients, and also for the common man. Today's lecture, although it is under the subject Swasthavritta, Preventive and Social Medicine, BMS, third year BMS students, they have this topic, Swasthavritta. But my dear friend, this lecture is very interesting for the newly married couple. Yes, come on. Who is seeing this viewer? They just call them, okay, Dr. Deshpande is talking about newly married couple. And though youngsters, they want to marry in within next 1, 2, 3, 4 years, they should know about this topic. But because many of your doctors or the relatives may not be knowing about this important concept with relation to your marriage ceremony. Because after marriage, definitely there you begin the family life and the sexual life. And for the sexual life, you must know what is exactly the family planning. So my dear friends, my dear viewers, please share this video to all the young generation who have just married couple or who are interested to marry within the next 5 years. Okay, so for them, everybody, the family planning topic is very, very important and also interesting. So let us start, and these are the two parts, family planning part 1, this video, and next after 1 week, there will be family planning part 2 video. So I request all of you to listen very carefully the important scientific information, but very simple language. Very simple language. Professor Deshpande has that much potency, power, skill that he can explain in a very easy manner. Family planning. So husband, wife, and their children, they must manage how many children that we should have. They should start discussing whenever they are a GF and BF, and if they are thinking about getting the life partner as such, then they must discuss about these points, because this is a inevitable part in everybody's life, and one should be very, very open about to discuss about the sexual thing and also the things related with the sexual life, because this is a discussion about the new generation, new progeny, that is the children that we have, whether it should be the 1, whether it should be the 2, whether it should be the 3, or Ashtaputra Saubhagyavati Bhava. No. 8 childs is not possible in this era. So that's why it is better to have 1 or 2 child. But when to get the child? Immediately after marriage? Immediately after 9 months of getting the marriage ceremony? Or whether it is after 2 years? Whether it is after 1 year? Is it in our hand to control the child birth to get the pregnancy, or it is not in our hand? Everything we are going to discuss for both partners, male and female, husband and wife. So be attentive for the lecture. Let us start to discuss what is the definition of the family planning. It is not directly something to do, but it is the way of thinking. How we think about our next family life. That is the thinking process is very important, and this is the basis of knowledge regarding the family life, marriage life, married life. This is the attitude. This is the responsible decision taken by the husband and the wife, by the girlfriend and the boyfriend. They must think about their life partner. When they start thinking about life partnership, they must go for this thought, family planning. Okay, so this is very important thing for the couples, newly married, or the couple, or the other partners who want to get married. Whether you live in the living in relationship or official marriage, whatsoever. But this is a part of your life, part of everybody's life. This family planning thinking process, education, is helping to promote the health and the welfare of the family. Health and welfare. Health of the husband, health of the wife, health of the children, welfare of the husband, welfare of the wife, welfare of the children, all the way. Like, for example, physical growth, mental growth, emotional growth, stability, everywhere stability, married life stability, our business stability, everything, this point is one way or the other connected. If you have the unnecessary, your income is very less, you don't have any proper source of income, and you are giving the child 3 or 4 birth, that is very, very wrong. Then these newly generated these children, they will suffer a lot. That's why I have used the word welfare, good things for the family. So what is the exact objective? Why we should learn? Why this video should be seen till the last point? Why? This is the answer. Just concentrate on the topics which are underlined by the red pen, and that points we must try to understand and remember. So these are the objectives of the family planning. Number 1, we don't want, that means couple, unwanted birth. For example, they are very young and still the job is not fixed, temporary job of the husband or the wife or the both. And if you don't know how to stop the newly birth, how to control the pregnancy, how to not get pregnant, then of no use. And your family members may be illiterate. They say, no, it's a God's mercy. No, bhaiya, no, aisa nahi hai. It's not at all a God's decision. It is your decision. So family planning to avoid unwanted birth. Number 2, bring about whenever we feel that now, yes, we both are ready by economical, by family support, by our physical, emotional, intellectual maturity, we are able to be good parents and we want child. Then at that time, we should get the child. Otherwise, there will be vandhyatva, infertility problems. So all these things are related with family planning. Regulate the interval between pregnancy. This is very important. Suppose you get one child, and then to bringing up of that newly born child for at least 2, 3 years, 4 years, it is very much essential. But if you have the pregnancy and just after that, immediately after 1 year, you are again pregnant. Oh my God, that is like a shock to everybody, to husband, to the wife, to the parents, to the family. Everywhere there is a shock. So the distance in between 2 pregnancies, that can be also decided by this family planning understanding. Okay, so to regulate the interval between pregnancies. First, I repeat, to avoid the unwanted birth. Number 2, bring about the wanted birth. Number 3, regulate interval between pregnancies, and to determine, most important, the number of children. For example, if the couple wants only 1 child, okay, fine. Couple wants the 2 child, fine, okay. Then how to stop permanently that process of getting pregnant? That is also one of the part of our discussion. Now, we are discussing how to control all these things. This is called as a contraceptive methods. Copulation, intercourse, and we have to control that process, sexual activity. Okay, contraceptive method help women to avoid unwanted pregnancy, that is contraception. These contraceptive methods can be temporary or can be permanent. Remember these 2 types. Temporary, prolonging, that means the lady has pregnant and now she don't want to get child or don't want to get pregnancy for minimum 3 years. Yes, there are some good methods that you can follow with the family planning understanding. And at last, at the age of, say, for example, 32, 33, 35, whole process of getting pregnant and getting child is over. You have the very good, healthy 2 children, and you want that I should don't have the tension of any time in my life to be get pregnant. Then there is a process. The husband can do the vasectomy. The female wife can do the tubectomy, either of. It is not both should do the operations. Anybody can do. Especially I will recommend that the gents, the male partner, husband should go for, because it is more easy, more comfortable, and nothing is wrong with that. Okay, so this is the contraceptive methods. Now, Next is a physical method. Let us try to understand what are the physical methods. Only this much. The most important, everybody knows about it, they hear about it. Condom, 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 use the condom. In the government hospitals, you get the free condoms. Okay? It is, by trade name, it is known as a Nirodh. From long duration, it is called as a Nirodh. Nirodh is a condom. But Nirodh is originally Sanskrit word. And what is the meaning of Nirodh? It is a prevention, a stop. Nirodh, like a Virodh. Nirodh, Virodh. Now you see the Virodhi Paksha, opponent party, you know, politics. That is Virodh and this is Nirodh. The same. Nirodh is stop. Stop. I don't want to be pregnant. So husband should have this Nirodh to control himself. This condom or Nirodh is fitted on the erect penis, remember. Next, withdrawing to take out that condom or the Nirodh from vagina, it must be held carefully, because to avoid the spilling of seminal fluid, that is the semen, into the vagina after intercourse. If you don't know the skill, and thus immediately after intercourse, somebody fails to take out very skillfully that condom, then semen can be poured or spilled into the vagina, and there is no use of the condom, no use. So, while doing the intercourse, after completing the ejaculation, the husband or the male partner should take out the penis out, and in a very systematic way, without hurry and worry, it should not be spilled out into the vagina, but outside he has to take out that and then proper care and then throw it out. Okay, so it should be taken care that it should not be skipped in the vagina itself. Then there is a danger, no use of the condom. Okay, what are the advantages of condom? Very interesting topic. Remember, why the male partner should use the condom? Number one, easily available, then safe and inexpensive. It is not too much costly. It is not, even government hospital, it is free. Any couple, they can go and they say, I want to do the family planning and I want the condoms. Then easy to use. There is not much complicated things to be followed. So very easy to use, no side effects. It is very light, it is very compact, and it is very disposable. So it is not a big problem to use the condom. This provides the, what you can say, your partner, your wife, will not be get pregnant if the male partner or husband is using the condom, but at the same time, it is protection against STD, sexually transmitted diseases. Remember this point, because nowadays it is also in the sexual education, it is said, by chance, if your egos or the desires are not getting properly channelized into the hobbies or getting occupied yourself, and by chance, if you are very, very much, what you can say, the restless, and you are visiting to the prostitute or the girlfriend, then the government or any NGO or any authority, they say, don't forget to wear the condom whenever you are not sure about your partner. During the sexual activity, if the male partner is not sure about the health condition of the female partner, then male partner should use the condom or the Nirodh to avoid syphilis, to avoid gonorrhea, to avoid AIDS or HIV. Condom is the best thing to be followed. This is the advantage in addition to the family planning. Okay, but disadvantage, what is that disadvantage? It slip off, it can come out or tear during the coitus, during the intercourse, and interferes sometimes. For some couple, the male partner or even female partner may not get very comfortable because they feel that their sex sensation is not proper locally. Sex sensation, they will not be happy with using the condom. Okay, so but condom is the best thing to be followed for two things: family planning and to prevent the STD. Now we will talk about the another aspect with respect to the female, but this is very rare in India. Mind well. In the male, condom is common, but in the female, condom is very uncommon in India. What is that female condom? It's a theoretical part. Of course, you can get in the medical shops, but very, very few. If you search or make a research, very few ladies are using this female condom. Pouch made of polyurethane, which lines the vagina. The cost is very high, and acceptability by the ladies or even the male partner is a big problem. Next is a diaphragm. The diaphragm is a vaginal barrier known as a Dutch cap, held in the position partly by the spring tension and partly by the vaginal muscle tone. Vaginal tone must be reasonable for the successful use of the diaphragm. The diaphragm is inserted before the sexual intercourse and must remain in a place for not less than 6 hours. Remember, even after intercourse, the lady has to keep it. It's not like a male condom. After intercourse, throw it away. No, it has to be there for 6 hours after sexual intercourse. Spermicidal jelly. Spermicidal jelly is always used along with the diaphragm. What is spermicidal? To kill the spermatozoa. Male eggs, they are called as a spermatozoa. Female egg is called as a ovum. Spermatozoa and ovum. We will go for the next page. Okay, here I can go. Both are usually made of polythene, that means diaphragm and that condom, female condom or other polymers. The non-medicated or insert intrauterine device are often referred to the first generation intrauterine devices. I think I must go on the left side. I am very sorry, my dear friends. This is something missing. I am sorry. Please allow me to go from the very beginning, because one should not miss anything in this discussion. Okay. Okay, I think we have seen this. Yes, this part we have covered. Am I right? I'm sorry, we have missed this part. Just please give me a few minutes. This is our first part. Here we are going, and then we have seen about the different contraceptive methods. I think this much is okay. Contraceptive methods, temporary and permanent. Now I think I must check this, and we have to begin from this part. Okay. So the term conventional contraceptives, when we talk about, I'm sorry, one part is missing over here. Conventional contraceptives are the condoms and spermicides. Each contraceptive method has the unique advantage and disadvantage. So we have to study the different methods. Unfortunately, I have immediately shifted to the condom, but before that, let me clear what are the exact methods. So this is the list of the methods. For family planning, there is an important list in front of you. Spacing method, that is a barrier method. One is a barrier method. Second is a intrauterine devices. Third is a hormonal methods, that is a tablet, contraceptive pills. And when there is a terminal method, that means when you complete your family, that is 2 + 2 or 2 + 1 or 2 + 3, you complete your family. Afterwards, you don't want any child, you don't want to get pregnant, that ladies, then there is a male sterilization and female sterilization. Male sterilization, you write down vasectomy to cut the vas deferens, and in female, fallopian tube is cut, that is called as a tubectomy. So these are the some methods: barrier methods, intrauterine, that is copper T, hormonal method means contraceptive pills or OC pill, oral contraceptive pills, that is this. So these are the T methods. And terminal, the last permanent, is a male sterilization, that is tubectomy, to cut that particular duct, and female, or there is not both, but all female sterilization. Now here is a next part that is called as a spacing method. Just I will go slow now. Okay. The aim of this method, spacing method here, okay, to prevent the live sperm from meeting to the ovum, because when do the intercourse, actually the male partner is ejaculating the semen. Semen is a liquid which contains the spermatozoa, that is sperms, plus what it contains, the secretions of the prostatic gland, most important, and other few secretions are there, and that fluid is having the spermatozoa or the sperms in plural form. Okay, so these sperms, they travel through the cervix, enter into the uterus, go to the fallopian tube, and there the union of the male gamete and the female gamete. In the fallopian tube, the spermatozoa and the ovum, they meet each other, and the fertilized ovum or the zygote is formed, and after 6 days, that fertilized thing is coming into the central part of the lady, that is uterus, garbhashaya, and that is implanted over there. And then the next 9 months, the development of that fetus is started. So I think I have just intimated how the pregnancy occurs. For the pregnancy, male and female union by the intercourse is very much essential. The gents, the male partner, husband, entering the penis into the vagina, and after friction, the male, after orgasm, the male is ejaculating the semen. Semen is a liquid which can be examined in the laboratory. It contains the sperms, and that one only sperm, that the husband or the male partner is throwing lakhs of the sperms, but only one spermatozoa meets with only one ovum, and then the fertilized product is first 5 days in the fallopian tubes, and then it is implemented into the uterus. Now, this is the barrier method, that whenever the intercourse is taking place, this method, for example, condom is a barrier in between, is like a wall. This condom is preventing the entry of sperm into the vagina and traveling up. So there is no union of the male gamete and female gamete. I think I'm trying to explain in a simpler language, okay? These methods don't have side effects, which can be, side effects may be there with the OC pills, oral contraceptive pills. Some ladies, not all, some side effects may be there. In the intrauterine device like copper T, there may be some side effects, but for the condom, male condom or the female condom, no side effects. Remember this thing, okay? Protection, this particular thing gives protection, condom, also from the STD. Reduction in the incidence of, in the ladies, pelvic inflammatory diseases, PID, because pelvic inflammatory diseases in the ladies is a big cause of infertility. Do you understand what I am saying? That the male partner may get, if he is having some extramarital affairs, in addition to wife or without wife, if he is visiting, he is not controlling his eagers, and if he is visiting to prostitutes or girlfriends, and by chance he is not knowing the health of the partner, and he gets the sexually transmitted diseases like syphilis, gonorrhea, HIV, then he transfers that disease to his wife at home during the intercourse, and that wife may get the infection of gonorrhea or syphilis or HIV, and there is in the female partner, in the wife, pelvic inflammatory diseases takes place, inflammation, infection in all female reproductive system, and that is the biggest cause of infertility, not getting the child. So be careful, my viewers, be careful, make educated to the newly married couples. Now I am moving my screen on the right side. I hope now you can give me the few time to adjust the screen. I think we have discussed all these points about the condoms and female condoms. And this is the time to go to the third page and making my screen on the left side. I hope you can adjust with me. Okay. We are talking about the female condoms or the diaphragm. The primary advantage of the lady's diaphragm is the total absence of risk and medical contraindications. Disadvantage, the insertion, lady condom, lady diaphragm, when she wants to insert inside, that needs the practice and also the privacy, and also requires facilities for washing and storing the diaphragm. So this is not at all popular. Female condoms, female diaphragm, not at all popular. Okay. Of course, few are using that. If the diaphragm is left in the vagina for longer period, there is a possibility of toxic shock syndrome. There may be some symptoms. Next barrier is a vaginal sponge. Vaginal sponge, rare. It is a small polyurethane foam sponge measuring 5 centimeter by 2.5 centimeter, saturated with spermicide. What is spermicide, sir? Killing the sperms, your male eggs, killing the sperms. Okay. Previously, sponge soaked in vinegar or sponge soaked in olive oil was used. Recently, it is commercially marketed in the US. America, these vaginal sponge are now popular, and they are called as vaginal sponge, used as a barrier, are common nowadays in America, which is called as today, T-O-D-A-Y, today. Today, I have to use it. So today, okay, it is less effective than the diaphragm. Now we will go further. That is called as a chemical method. Second is first it was a physical, now chemical. In 1960s, before the introduction of intrauterine device, that is copper T, or before contraceptive, oral contraceptives, spermicides were widely used. Spermicide, killing the sperms. Spermicide, killing the sperms. 4 categories were there. Number 1, foam, that is foam tablets, creams or jellies, suppositories inserted manually, soluble films, C, films inserted manually. Modern spermicides are surface active agents which attach themselves to the spermatozoa, male egg, and inhibit oxygen uptake and kill the sperms. Spermicidal. Okay. The main drawback is that they must be used almost immediately. Can you see here disadvantages? Before the intercourse and repeated before each sex act. This may cause little bit burning or irritation to the females. They are best used along with the barrier methods like condom. These are possibilities of teratogenic effect. Afterwards, when the lady gets pregnancy, the child can get some cancerous effects following their use. Now we will talk about very important part of the family planning, that is intrauterine devices. Types of intrauterine device, IUD, please write down, IUD. 2 basic types. One is a non-medicated and second, of course, is medicated. So my dear friends, please allow me to move the screen on the right side. We are talking copper T. We are talking IUD. IUD. Okay. So one is non-medicated, another is medicated. Now, both are usually made up of this polyethylene or other polymers. The non-medicated or insert IUDs are often referred to as first generation intrauterine devices. The copper intrauterine devices comprise the second, and the hormone releasing intrauterine devices is the third generation. Research and research and research. So slowly, because of the researches, we are getting powerful intrauterine devices. First, non-medicated. Second, with copper. Third, with the hormone. First generation, non-medicated. Second generation of IUD with copper. Third generation is with the hormone releasing. Okay. So let us start talking about one by one. First, we will talk about first generation intrauterine devices. They have the different shapes, different sizes, loops, circle loops, spirals, coils, rings, and bows. So these are the different shape. 1, 2, 3, 4, 5. Lipase loop, famous previously. Best known and commonly used device in the developing countries like India. Lipase loop. Maybe SAQ may be asked on this. Lipase loop is a double S-shaped device made up of the polyethylene plastic material that is non-toxic. It contains small amount of barium sulfate. Why? To allow when the X-ray is taken of the abdomen, it is seen through that, yes, this lady has this lipase loop inside. Okay, by the X-ray you can diagnose. The loop has attached threads at the end or tail. It is also called as a tail, made up of fine nylon string, which project into a vagina after insertion. So the lady knows that this thread indicates I have some instrument inside, lipase loop. Okay. The lipase loop consists of the 4 sizes A, B, C, and D. The larger are C and D and more suitable for multiparous women. Doctor, what is that multiparous? Having multiple pregnancies. Not only not a single is a nulliparous, then multi is 1 child, 2 child, 3 child, 4 child, multiparous. So because the size is more, so larger size loop is used. We are going further and we are talking about second generation IUDs. Just let me mark first and then I will move up. Yes, second generation IUDs. It is found that metal copper is a strong anti-fertility effect. Copper is not allowing you to get fertile, to get pregnant. So copper is like a anti-pregnancy. Okay. So copper was added to the intrauterine devices. So the name earlier devices were copper 7, copper T, very famous, copper T 200. It is the name of the instrument. Now the newer devices, nowadays there is a copper T 220C, copper T 380A, Nova T multi-load devices, that is ML, multi-load, CU250, multi-load, CU375. So can you read the number 7, 200, 22C, 380, 250, and 375. So these are the different types of the copper T available. The number included here, the names of the devices refer to the surface area in square millimeter of the copper on the devices. How much is the copper? That is in square millimeter. Nova T and copper T 380 Ag contains, Ag means silver core over which the copper wire is wrapped. Inside there is a silver and above that there is a copper wire is wrapped. I think you are a little bit understanding what we are talking about. Copper T intrauterine devices to avoid the pregnancy. Okay, we will go on the next page and please allow me to move the screen on the left side. So, advantages of copper devices. Benefits. No expulsion rate. It will not come automatically outside. Less side effects. There will be very less pain or no pain. There will be very less bleeding or no bleeding. Easier to fit even in nulliparous women. The woman who has not still children, she also can take this copper T. Better tolerated by nullipara. Increase the contraceptive effectiveness. Very good, very good. You will not be pregnant, 100% sure, damn sure, okay? Effective as a post-coital contraceptive, oh my God, if inserted within 3 to 5 days of unprotected intercourse. Are you understanding what this particular write-up? Suppose husband and wife, they have enjoying their life, family life and sexual life, and they forget to take the oral contraceptive pill, and they don't now they are confused what to do, and they have not wear the condom, not taken any precaution, no safe period, etc. during the menstrual cycle, and OMG, oh my God, what has happened? She has missed, or she has understood that we had done wrong thing. Without protection, we have done the intercourse. Then they immediately go to the doctor, and then doctor can put this copper T within the period of 3 to 5 days after unsafe intercourse. Even that can create the protection that the lady will not be pregnant. Okay. So this is about the second generation of the copper T. Now, my dear friends, we will discuss the third generation's intrauterine devices. So if you are a newly married couple or going to marry, see this video again and again and try to get understanding. So why necessary? We will go to the doctor. He will decide. No, my dear friends, self-education is the most important part in the life. Okay. So these are the hormonal intrauterine devices, and they release the hormone. The most widely used hormone device is progesterone. Can you see progesterone? P-R-O-G-S, progesterone. You have to remember the spelling, huh? P-R-O-G-E-S, progesterone. The hormone is released slowly in the uterus with the rate of 65 millimicrogram daily, because the hormone supply is gradually depleted. Regular replacement of the device is necessary because it is releasing the hormone in the uterine cavity, that particular instrument. So the instrument will be less, the battery will be down. You have to again replace it with a new hormonal loaded gun. That is like a loaded gun. Another hormonal device is LNG20. It is a T-shaped intrauterine device releasing 20 millimicrogram of levonorgestrel. This is the name of the hormone. Levonorgestrel. The name of the hormone. The hormonal devices would be particularly valuable if the woman is in the developing countries in whom there is excessive blood loss caused by insert device have been shown to result in significant anemia. That means if she has experience with the copper T and she has a lot of bleeding, she is suffering from anemia, then this is a better option than the copper T. But these devices, unfortunately, are still quite expensive. We will go further and try to understand what is the mechanism, how these intrauterine devices are working. What is the mechanism? These devices, can you see here, act like a foreign body reaction in the uterus. There will be cellular and biochemical changes in the inside of the uterus, that is endometrium and uterine fluid, and it is believed that these particular changes will stop the viability of the gamete. That fertilized ovum will become over in the implantation, it will not survive. Fertilized ovum will not survive because they are distorting. These IUDs are distorting the inside of the uterus and reduce the chances of getting pregnancy or fertilization. So copper ions are affecting the sperm motility. Copper T, that they are affecting the capacitation and also survival of the male eggs or the sperm or spermatozoa. Hormonal releasing devices, they increase the viscosity, density of cervical mucus. And by that, they stop or prevent the entry of the sperm into the cervix. They also maintain hormonal high level of progesterone in the endometrium inside of the uterus and relatively low level of the estrogen, thereby sustaining an endometrium unfavorable, not good for the implantation. So I will now move on the right side of the screen and we will continue our discussion of the intrauterine devices. Intrauterine devices. Okay. Effectiveness. The intrauterine devices most effective, number one, and they are reversible contraceptive methods. They are not like a cutting, tubectomy, vasectomy. No. When you take out that copper T, start enjoying getting pregnancy. You can get the children. Whenever you remove the copper T, there is no obstruction to the spermatozoa, to the sperms. Your uterus will be normal, healthy. So everything will be favorable. The lady can be pregnant after removing copper T or hormonal provided these IUD, intrauterine devices. Okay, so this is the most effective method. Then the copper T 380A is approved for the use of 10 years. One inserted, no worry, for 10 years. The copper T 200 is approved for 4 years and the Nova T is for the 5 years. So one must remember how much is the viability of that particular instrument, and that is giving the protection either for the 10 years or for the 4 years or for the 5 years, depending on the intrauterine devices. The levonorgestrel intrauterine device can be used for minimum 7 years and maximum 10 years. Now, advantage of intrauterine devices. Advantages. What are the benefits? To insert into the lady, into the vagina, this intrauterine device is not complex. It is very easy at the level of OPD. The lady should not get admitted. Don't worry. No admission, no surgery. No admission, no surgery. Only going to the gynecologist, your lady doctor, and she will insert that instrument into the vagina, into the lady's body. Okay. Insertion takes only few minutes. Once inserted, intrauterine device stays in place as long as the mentioned time period above 4 years, 2 years, 5 years, 10 years. Okay. This is not expensive. In the government hospital, free of cost. Contraceptive effect is reversible by removal of this device. Take out the device, enjoy. You can be pregnant. Okay. Highest continuation rate. The ladies, they continue to take this copper T or the hormonal assisted intrauterine devices. There is no need for continuous motivation required for using. For example, if you are using the condom, the doctor, family members, wife should always insist, please wear the condom, please wear the condom. If she is taking the contraceptive pills, wife or your partner, the male has to remember, have you taken the pill? Have you taken the pill? Every day follow-up is necessary, but intrauterine devices, no such follow-up, no such repeated inquiry is essential. Okay, that is the benefit. Next is a contraindication. But unfortunately, in some cases, doctor cannot give the intrauterine devices. What are those conditions? Number one, if whenever the couple is visiting to doctor and doctor is suspecting, oh, this lady may have pregnant before, don't insert the copper T or these IUD. Pelvic inflammatory diseases. If the doctor is doing the sonography, blood test, and he has found that she has an infection or inflammation, female genital organ, pelvic inflammatory disease, PID, no IUD. Vaginal bleeding of undiagnosed etiology. Why this is bleeding is going on? Menorrhagia, metrorrhagia, polyp. Why? Reason? No reason. Then don't insert that IUD. Cancer of the cervix, no IUD. Cancer of the uterus, cancer of the fallopian tube, that is adnexa, you cannot make these intrauterine devices. Previous ectopic pregnancy history, don't use these intrauterine devices. Now we will go on the next page, and I have to move the screen on the left side. Now, some points for not using IUD, intrauterine devices, is relative. That means if the problem has been solved, then you can insert the intrauterine devices. So these are the conditions. Anemia, you correct the anemia, then you can insert the intrauterine devices. Menorrhagia, you try to find out the cause, treat it menorrhagia properly, you can insert the intrauterine device. History of PID since last pregnancy, you can treat it by good antibiotics. If pelvic inflammatory disease, go insert the intrauterine device. So these are not absolute contraindications. That is why they are called as a relative contraindication. इसमें ऐसा नहीं होता कि नहीं बिठाना मतलब नहीं बिठाना. If these problems are sorted out, then yes, intrauterine devices can be implanted. Distortion of the uterine cavity due to congenital malformation and fibroids, unfortunately, here you cannot make the compromise. You cannot place the intrauterine device. Unmotivated person, if the lady is stubborn, no, I don't will, I don't take, I will not, then you doctor cannot help for such patient. Okay. Next topic is ideal intrauterine device candidate. Who is the best female or the candidate to insert this thing? First, who has born at least one child. If she has one child, then that is the right lady that she can get intrauterine device inserted. Has no history of pelvic disease, pelvic inflammatory disease. No normal menstrual periods are there. So good, you can put the IUD. Willing to check the IUD tail. She is ready. Lady is a little bit convinced. She has counseling has been done, and she is ready to cooperate. Then you can put the IUD. Now, next question will arise. Okay, we have decided to put intrauterine devices. When to put? So this is the instruction. Within 10 days of the beginning of menstrual period. That means menstrual cycle 4 days finished. Immediately on the 5th, 6th, 7th day, you can insert this IUD. Because why? Because technically during this period, insertion is easy because diameter of the cervical canal is greater. So insertion is easy. Uterus is also relaxed. Convenient type for loop insertion is 6 to 8 weeks after delivery. But intrauterine device insertion immediately after a second trimester abortion is not recommended. You have to wait for some times. Now we will talk about the follow-up. Intrauterine device, when to go for doctor again for checkup. To confirm the presence of intrauterine device, the diagnosis and treatment of side effects or complication, one must go to the doctor. The intrauterine device wearer, that means that lady, should be examined after her first menstrual period, after that inserting the IUD, because the doctor must know the chances of loop expulsion are high during this first menstrual period. So doctor will check and will confirm that, okay, no problem. IUD is there, device is inside there, no worry, no tension. Let me allow to move the screen on the right side. And now we are discussing IUD. These are some side effects and complications. First is a bleeding. Okay. If the bleeding is heavy or persistent, the patient develops anemia, and in spite of the iron supplement, patient is not responding, then only you have to remove. Sorry to say, you say to the patient, to that lady, sorry, you have the bleeding, you have the anemia, we want to treat it very carefully. I have treated it, but still bleeding is going on. So please take out this intrauterine device. Number 2 complication or the side effect is pain. Pain is the second major side effect. Low backache will be there. Some ladies are not for all. Cramps in the lower abdomen. Symptoms usually disappear during the course of 3 months. Then no problem for next many years. To begin with, there will be little here and there. Then third part, I'm sorry, I will have to move, take there here. Okay. Sorry, my dear friends. Okay. Third side effect is pelvic inflammation. Can you see here? Of intrauterine device, there may be pelvic inflammatory disease, that is PID. This is a collective term. What is exactly, sir, PID? Explain us. This is acute or subacute or chronic condition that of infection of the ovaries, infection of the fallopian tubes, infection of the uterus, connective tissue, and pelvic peritoneum. And this particular inflammation, infection will cause much more trouble to that particular lady. Next, we will go on the next page. And for that, we have to move on the left side. So, the clinical features of this PID is vaginal discharge. The lady will complain, vaginal discharge will be there, pelvic pain will be there, backache, tenderness, abnormal bleeding, little bit fever and chills. Even 1 or 2 episodes of PID can cause infertility permanently, blocking the fallopian tubes. So PID is not good to be continued. Immediately treatment, immediately higher antibiotics should be given by the doctor and get it cured. Okay, so their broad spectrum antibiotics are used. We are talking about IUD complications. So these are the next complication. Uterine perforation can occur very rarely, very rarely. Pregnancy with IUD is a potential medical complication. Then there are chances of ectopic pregnancy. There may be expulsion throughout. During the first few weeks following the insertion, the instrument is automatically thrown out because of the spasm in the lower abdomen. Then maybe very rarely fertility after the removal. That lady can be pregnant, or next time it is very difficult to get pregnancy. But these are very rare complications. Cancer and teratogenesis, no evidence till date that after inserting IUD, somebody has getting the cancer is not at all. So there is no evidence to date, that means today, that IUD can increase the cancer risk. So no worry about. Mortality associated with IUD use is extremely rare. Okay. Now we will go further and we will talk about hormonal contraceptives. This is the most effective spacing method of contraception the lady is using all the time, that oral contraceptive pills. So let us talk about the OC pills. OC pills, I'm sorry. So estrogen and progesterones are the gonadal steroids, but in the OC pills there are synthetic estrogens. 2 synthetic estrogens are used in the oral contraceptives, that is ethinyl estradiol and mestranol. Ethinyl estradiol and mestranol. Synthetic progesterones are also used, like for example pregnance, estrens, and gonans. These are the names you can forget about, or right now it is not necessary to remember. You remember synthetic estrogen and synthetic progesterones are used in the OC pills. Now we will talk about the classification. We are talking about OC pills. Okay, here is the classification. Oral pills, that is a combined pill. Progesterone only pill, that is POP. Post-coital pill, unsafe intercourse has been done and then both are afraid, oh, the lady can get pregnant, then immediately they can take the emergency pill. Once in a month, long-acting pills are also available. Male pills are not that much popular. Depot means slow release tablets are available. Then there are some injectables. There may be subcutaneous implants and vaginal rings are also available. Now, oral pills, these are the combined pills. In 1960s, original pill contained 100 to 200 micromilligram of synthetic estrogen and 10 milligram of progesterone. We are talking about OC pills. At present, most formulations of this OC pill, oral contraceptive pill, combined pills contain not more than 30 to 35 mcg of synthetic estrogen and 0.5 to 1 milligram of progesterone. This is given orally for 21 consecutive days, followed by a break of 7 days, during which period that menstruation occurs. Again, the pill should be taken every day at a fixed time. That is most important. Types of the pills, two types of low dose oral pills. The names are Mala N and Mala D. It contains levonorgestrel, 0.15 milligram and ethinyl estriadol 0.03 milligram. Mala D is a package of 28 pills. 21 are the oral contraceptive pills and 7 inert, that they don't have any effect. 7 brown film coated 60 milligram ferrous fumarate. These are the iron to protect from the anemia. This is not a family planning type of material. This is to protect the lady from the getting anemia. Price is ₹3 only per packet. Mala N is supplied free of cost through the primary health center. Next is a progesterone only pill. Progesterone only pill. Can you see here? We are talking about oral contraceptive pills, commonly known as the mini pill or the micro pill. Mini pill or micro pill. Okay, it contains commonly used progesterones are norestetesterone and levonorgestrel. Their names are a little bit complicated. Poor cycle control and increased pregnancy rate. This is a risky type of the tablets. Could be prescribed to the older woman for whom the combined pill is contraindicated because of the cardiovascular diseases. So above 35, above 40 especially, you gave the only progesterone type of pills. Post-coital contraception. Post-coital or morning after. That means the last night the couple has the intercourse and next morning they get shocked. Okay, because of the unsafe type of the intercourse. Is recommended within 72 hours of unprotected intercourse. IUD, the simplest technique is to insert an IUD is acceptable, especially a copper device within 5 days. We are talking about post-coital, unsafe intercourse and what to do. Okay. Now I have to move on the right side. Please give me only 5 minutes. We will complete this page and next we will see in the next hour lecture. Okay. We are talking about the contraceptive pills. So, hormonal. In India, levonorgestrel 0.75 milligram tablet is approved for emergency contraception. That means unsafe intercourse. It is used as one tablet, 0.75 milligram within 3 days, 72 hours of unprotected sex, and the second tablet after 12 hours of the first dose, or there may be mifepristone 10 milligram once within 72 hours. Okay. Post-coital contraception is advocated as an emergency method after unprotected intercourse or after rape or contraceptive failure. Now there is a last type, that is a once in a month tablet, long-acting pill, that is Quinastrol, a long-active estrogen is given in combination with short-acting progesterone. The pregnancy rate is also high in these cases. Then male pill, research in male pill has following approach, preventing the spermatogenesis. An ideal male contraceptive would decrease the sperm count while leaving testosterone at normal levels. A male pill made of gossypol, a derivative of cotton seed oil, producing azoospermia or severe oligospermia, but 10% of men may become permanently azoospermic after 6 month consumption of also gossypol could be toxic. Now, Mode of action of the oral pills. You can see the mechanism of action to prevent the release of ovum from the ovary. It is achieved by blocking the pituitary secretion of gonadotrophin that is necessary for ovulation to take place. Progesterone only preparations to render the cervical mucus more thick and scanty and thereby preventing the entry of sperms. My dear friends, family planning is a very big topic, but we have today covered a lot of things like talking about condoms, talking about intrauterine devices, and now we have nearly completed the oral contraceptive pill discussion. The remaining part we will continue in the next week's lecture. Till then, I wish all the best. Take care and see you tomorrow with the Charak Uttarardha subject. Thank you very much.